visceral. This is just I came across this from one of my teachers. I don't know what to call it, so for me it's into myofascial.
Steve is going to hold the microphone for you.
Do I have to? Hello? Do I have to tip him when it's over? Okay. So a lot of the things that I learned in osteopathic techniques, they were not in the classroom. You know, they weren't a course of this technique or that. It was working with people that have been treating people for 30 and 40 years. A lot of people that have put the time in, like Dr. Sammy, and I said, well, how do you treat? Well, Dr. Sammy, I can't use you as an example because you're in a school that's teaching. If I get Dr. Sammy, who is not dean of the school and teaching things and learning new things, and he was just out in the patient world, and I said, what do you do for the low back? They would just start to show me the movements and tell me, do you feel this, Steve? Do you feel that? And I learned from a lot of people like that. And one of the things I learned was this. I'm going to stay on the same side of the spine. So here's the spine's process, and if I feel a tight spasm in the rectus spinae, I'm going to put my thumbs on the long belly of the muscle. Okay, and this long part. I'm not going to hurt you. But if he has a spasm, it will be uncomfortable. It might be very uncomfortable. As long as I'm doing it methodically and sinking into him, he has the ability to tell me to stop. He has the ability to tell me to stop. So I'm going to go on both ends of the muscle belly, just off the sacral base and about 6 or 7 centimeters above. I'm going to put my fingers straight down into him and bring them together. So I tent the skin. Okay, and your fingers are not going to travel. They're not going to slide on the skin. So if I start about 6 or 8 centimeters away, and I lean into him, and I bring my fingers together, then I'm going to bring my fingers up, go a little bit closer, same thing, down in, and together. And I'll do that 2 or 3 times. And I asked this old person who showed this, why do you think that works? And he said, well, maybe we're putting pressure at both ends of the muscle, and so the muscle spindle doesn't know how to react to it. If we put pressure near near the end of the muscle, we're going to get a reflex if we do it quick enough, right? So here, maybe because it's omnidirectional, the muscle doesn't know how to react. I don't want to tell you that's true or not true. The technique works.